Uh, this is Samuel Sane here at KIMS, the Cardos, and I am with my friend and my good friend, Dr. Babu, the pediatrician. Doctor, say hi to my people.
How are you doing? Yeah.
I am also having a very special sister.
Hello.
She is an assistant manager, the Cardos. See Arul Meda.
Yes.
Sister, you can say hi to them.
Okay. Hello. Hi. Good afternoon. I am Arul from KIMS Hospital, Secunderabad, and I am working since 12 years in KIMS. And I am so lot of bond between KIMS and me because I have been working for since long time. And I have been working in pediatric CT/ICU. It is pediatric only cardiac CT, cardiac thoracic department, and the department has specialty surgeries like VST, AST, and TOF and BT shunt. So many surgeries, like more than 47 kind of surgeries we are having. And now I will show how many cases we are having inside the unit. And so, good afternoon. Welcome you for seeing the cases, which are the cases we are having, and we will be having the surgeries plus the procedures also, and procedures like invasive procedures like whatever cases we are able to do without the surgery, opening of the heart. For opening heart surgery is such a big surgery. So instead of that, we want to revolve the problem without the opening the heart. So we do through the thigh. Through the thigh and procedure it is called, not a surgery, open heart surgery. So we do invasive procedure and we make the heart to be healed okay. Yes. But another surgeries like such, whatever we are not able to do because the hole will be big or small, yes, according to the minimum we will be taking that, and we will be assessing the patient for surgery or not surgery. So non-invasive procedure we will be doing the procedure. The surgery which we are doing, we are having Dr. Anil Kumar as a surgeon. He is very senior most surgeon here. As a pediatric cardiac department, and anesthetist we are having Dr. Nagarajan sir. He is anesthetist for the cases for them to become paralyzed in the body. So the surgery will be performed every day. Wow. In our hospital.
Wow, thank you so much.
Thank you.
Arul, let's show us the procedures and the surgeries.
Okay.
And what you do.
Okay.
Thank you.
Please, most welcome, sir, here. So this is a case like this is 2 months baby.
2 months baby.
Only 2 months baby. This patient is having the diagnosis.
Newborn baby.
Newborn baby,
old.
2 months old. This baby is having actually the TOF diagnosis. Because the TOF is, we have to do the correction after becoming big. But in order to prevent from dying the baby, yes, we do first the case is BT shunt to prevent from blood from, yes, this one for the deoxygenated blood to be solved problem. So we do first to save the baby we do the BT shunt. Yes. Instead of doing the full correction, we do half correction because the baby has been grown up bigger. Then only we can do the full correction of the baby. Yes. So now we have done the BT shunt through this way. So once the baby will become 5 years, then we will be doing the full correction that from here we will do in the mid area.
And what is this in the mouth? I always see children.
This is a nipple, called honey nipple it is called. Inside this nipple there will be honey. Honey. So just we prick hole and we give. So honey. In order, honey.
I wonder what is this? And yeah, I know most of the people don't know what is that.
Okay.
Yeah.
Because to prevent from crying, we used to keep for babies.
So honey is sweet.
Yes.
So the baby will enjoy having the.
Yes.
Oh, wow. Yes. That is good. Yes. Now already treated?
Yeah, already the surgery is done, and today is the baby is having the 3rd day pre-op, baby 6th day of post-op. So baby is now recovering from this one. And the baby will be discharged.
I can see sucking the honey.
Yes.
Okay. Wow.
And the baby now in a recovery stage because we have removed from the ventilator and everything. Yes. Now the baby is on recovery stage.
Wow.
So within 2 or 3 days, we will be shifting the baby to the unit. Means another ward. This is an IC.
What's the name of this machine?
This is like warmer, baby warmer.
Baby warmer.
Yes. because the baby will have cool temperature. According to the body temperature, we'll be maintaining the manual in this, and the baby will get heat from the.
Oh, wow. And there is, at what temperature? 36.5
Yeah,
degrees.
36.5. It is a normal temperature
Normal
for
temperature.
the baby.
Wow. Another question.
Yes.
How does a mother breastfeed his child here?
Yes. Once now baby is on recovery, the mother will be calling for every second hourly for feeding. So now we will not be giving direct breast milk.
Yes.
Because baby still have to recover.
Yeah.
So we will be taking the mother's feed in the bottle, feeding bottle, and we will be giving the feeding for the baby.
This is great.
Yes.
Wow. We can proceed to another procedure.
After 2 days, we will take the mother to come and sit here,
Yes.
and we will be making the baby to feed in order to see that how mother is feeding for the baby and everything.
Wow.
So we observe the mother and baby. Correctly she is giving the milk or not, and we will be diluting the milk.
Yes.
Bottle milk we will be diluting and we will be giving, or we can give for the breastfeeding also. She will be express and she will be giving the milk in the bottle. So that also we can give for every second hourly.
Yes.
So every second hourly we will be giving 30 ml of feed, because baby is 2 months baby, so only 30 ml is allowed.
For how long will the baby be here?
Baby now 6th day. Baby is here till today is 6th day. 6th day.
Then
After 2 days, now the baby looks fine. So we'll be shifting after 2 days to the ward. This is ICU. We'll be shifting the unit in the ward.
Oh, wow, that is great.
There baby will be with the mother, and there also we'll be observing for 2 days, 2 or 3 days.
Yes.
If a baby is fine, mother also taking care of the baby very well, then we'll be sending them home.
Wow, this is great. Very encouraging.
Yes.
Thank you for taking care of children.
Okay.
Take us to the next procedure.
Yes.
And then we see. Okay.
Okay. Thank you. The next, the case this we have seen. The next case I will be showing you.
Thank you.
This is around like 4 years of child. This child.
4 years.
And 4 years.
Yes.
And the baby has undergone the surgery of VSD. VSD means ventricular. VSD means ventricular septal defect. Means in the heart there will be a hole. So that hole will be closed by our doctor. So this case we have done the surgery because procedure it will not be help for the baby because of the hole. Minimum will be more. So this has to be open heart surgery. So they have done the open heart surgery. Today is day second. Second. Actually yesterday baby was in the ventilator.
Okay.
So from ventilator, once weaning is over, then baby will be out of danger. So we have taken the baby and we have kept only the oxygen support.
Oxygen support here.
Oxygen support baby is having. So now this baby also will be minimum 3 or 2 days will be here in ICU. Then we will be shifting to the unit department. This is actually the small case according to the surgery because it is VSD. AST, VSTs are the hole. Minimum hole will be there. So we will be closing and we will be shifting the case.
Okay.
This is not a complex case. This is not complex case. It is a surgery case.
Okay.
But that is a complex case.
That's a complex case. Okay. The question is this is the way you are feeding the baby?
No. This is all that inotropes which has been given for the baby because baby has been undergone the surgery. So we have to minimum we have to give for 3 to 4 days or 5 days. We have to give the inotrope. It is dopamine. Inotropes it is called.
Yes.
Not the feeding. This baby, because this is 4-year baby, can take orally feeds and everything.
Okay.
No need of, we will be feeding the baby.
You'll be feeding the baby.
We will be giving the food and everything.
Okay.
Soft diet will be allowed because now second day of POD. So first we will be giving the liquid, then we will go for the soft diet, then we will go for the full diet.
Yes.
Meal.
Wishing him quick recovery.
Yes.
Yes.
Okay.
Wow. Let's go to the next case.
Next, this baby also is around the age of This also around age of, that is 4. This is 2 years
Age
old.
2 years old.
2 years old.
Uh-huh.
This baby also has undergone the same surgery like VSD.
Uh-huh.
Same.
Same,
That
same.
baby and
Open
this
heart
baby
surgery.
same. Yeah.
Okay.
Today is first POD. Yesterday done the surgery. Yesterday this baby has undergone the surgery.
Okay.
So they have been taken out from the ventilator. Then same.
Yes.
O2 support and everything. High note drops are going on, and baby will become all right within 2 or 3 days.
Okay. Wow. So boy.
Boy.
Boy. Wow. You'll be fine, sir.
Yes.
Yeah. At least I'm happy and encouraged. You're doing a good work.
Okay, thank
and
you.
hoping for the best. Thank you so much.
Thank
you can
you.
proceed to the next department.
Okay.
Okay.
Thank you, sir.
Welcome. Thank you for information. Let's start. Proceed, doctor.
Hi, this is Dr. Babu S. Madarkar. I am a neonatologist working at KIMS Cuddles, Hyderabad. So neonatologist is somebody who takes care of newborn babies. We all know that there is something called as pediatrician. Pediatrician is somebody who takes care of children. To become a neonatologist, we need to have furthermore training beyond being a pediatrician so as to be able to take care of small, tiny babies. Here in KIMS Cuddles, we offer a couple of services. One kind of service is taking care of small, newborn, tiny, premature babies suffering from various ailments. We take care of them. Second kind of services that we do is the long distance retrievals, which actually means, as you know, that India is a very big country and babies suffering at various distances all across India, maybe around 1,000 miles away, 2,000 miles away. When they need high-end care, we have a very good system wherein we go stabilize the patient, baby, and then we do the retrievals either by air ambulance or by road travel, and then get them to this center and then offer them the best care. The third kind of service that we offer is teaching and training. We feel that this is extremely important for us to teach and train and spread this knowledge amongst the doctors and amongst the general public. This makes us, gives us a lot of power, lot of responsibility, and then make sure the long-term sustainability, long-term life is well maintained. So with this concept, we have initiated the Cuddles. Cuddles basically runs on principles of high-end care, affordability, and easy accessibility. So we have been doing all this under the platform of continuous research and innovations. So I find I deem it a great pleasure, and I deem it a great opportunity to be associated with my very good friend Samuel, who has taken his good time to come over to us and make sure that our services are well known to people all around. And I am also a firm believer of the fact that it is not only opening up of a high-end care center is important. We have to make sure that we reach out to public who need the services. That is what it makes the difference. So I welcome you to my neonatal intensive care unit, and I'll show my unit. Thank you very much. Please come in. Please come. Please come. Strong. Hi. Please come. Samuel, I have a very emotional story to let you know.
Tell me.
So, it was 10 days back. A pregnant woman, she comes to the emergency, and she collapsed.
Yes.
And we saw the woman. Her heart has stopped, and she is not breathing. And it was as good as she has died.
Wow.
So it was a very difficult scenario for us. We started this resuscitation, wherein we started pumping the heart, and we did electric defibrillation, and then initiated the heart.
Yes.
And then within next 40 minutes, it took us to stabilize the mother, And then she was put on ventilator and shifted to the ICU.
I see.
And then to our surprise, we get to know that it's a twin pregnancy
Yes.
that mother is having. And then we thought, because mother's heart has stopped,
Yes.
mother's oxygen levels have fallen down, quite obvious both the babies would have died inside.
Yes.
So, but then we have to remove those babies out. We
How
cannot
many
keep
babies? Two.
two babies, twins.
Wow.
So the mother was taken in next 6 hours to the operation theater to remove those babies. And then we removed those babies.
Yes.
Those babies were fighting, showing signs of life.
Wow.
Although mother had died, mother was surviving. Those babies also were showing the signs of life.
Yes.
So we put those babies on ventilator, and then we started our treatment.
Wow.
And here are those two babies
This
who
one?
have fought out the death,
These are great.
and then are showing the fighting spirit. And it is this spirit which is always making us to never leave, leave,
Yes.
never get away a kind of attitude. We always persist, keep trying. Only when we'll be able to make difference in terms of somebody's life.
How old are they?
So this baby was born on 22nd of
22nd.
September. Now around 18 days of life.
Yes.
Preterm babies, premature babies. At birth, they're very small, tiny.
Yes.
They have gone through many of the issues which preterm babies have,
Yes.
like breathing issues,
Yes.
heart pumping issues,
Yes.
feeding issues. Now all of those issues have been sorted. Now they are getting fitter. Maybe in a couple of days, they'll be going home. So
Wow.
this spirit is the one which is never letting us to
Yes.
give up.
I like that. What about the mother?
Mother is fine. Mother has got discharged to home.
Wow.
She's waiting for the babies to come back
It's a
to
miracle.
home. Yeah.
Very encouraging. How old are they?
They are now 18 days.
18 days.
18 days of age. But then they are here because they are premature. This baby was around 33 weeks of age,
Yes.
which actually means around 7 months
7 months old.
of pregnancy.
They'll be fine.
Now they are fine.
Wow, they are
So this is the first baby, and this is the co-twin of the other baby. This baby being little smaller has been suffering from various issues, predominant of which is the breathing part, which is why baby has been getting nasal support through the nose. We are giving oxygen at certain pressures.
Yes, yes.
With that, baby is able to sustain life. We are very sure that by this kind of therapy that we are doing, wherein we are offering the care as good as mother's womb, wherein the temperature, humidity of the babies are maintained.
Yes.
And then we are also supplying all the food that baby requires through the tube which goes into the umbilicus and through the OG tube, with which the baby is doing well. So this is co-twin. Both are
For the feeding,
yeah.
what do you feed that baby with?
We are feeding with mother's milk. We are
Mother's
asking
milk,
we are asking mother to express and send it to us.
Yes.
And we are feeding through the tube.
Uh-huh.
And then this baby, although smaller, but has shown very good fighting spirit. And then this motivation is helping us to fight and strive for more and bigger and better.
Wow. Very encouraging.
Yeah. Very nice.
Very encouraging. Thank you, doctor, because I know you never disappoint. I know you have good stories encouraging to those mothers who maybe they might have given up, giving birth. At least now you are telling them it is possible.
Yeah.
Thank you, doctor. We proceed to the next.
Yeah. So, hi Samuel, I have one more story to tell you.
Yes.
This baby was born to a mother after completed 9 months of pregnancy, and this baby was with the mother, doing well, feeding well, doing well, and parents were really happy.
Yeah.
So when we went for the rounds in the hospital on first day after delivery, we found that baby's heart has stopped, baby is not breathing, and then baby is limp, which is as good as baby has had death.
Yes.
So we did our evaluation, and that evaluation had to happen in couple of seconds and couple of minutes.
Yes.
We get to know that there is a condition called as pneumothorax, which actually means bursting of lungs. One of the lungs had got burst out, and then all that air had got accumulated and was compressing on the lungs as well as the heart. We took this baby immediately, did a small surgical drainage of that extra air in the lungs, and then baby magically improved. And it was like a miraculous godly intervention where then baby started breathing,
Yes.
started crying, and doing well. And this is the baby now doing well, and now we are planning to ship this baby to mother back in next 3 days. I mean, all these things happened in 3 days, and now baby is fit to go home. And it's, for us, it is so satisfying, so fulfilling,
Yes.
to see that baby is actually has gone, knocked the door of the death, and has come back.
Yes.
And being part of that process of surviving somebody, nothing in the world can accomplish that kind of satisfaction.
Yes. Yes.
So this is that kind of baby doing well.
Feeding also on milk.
Yeah, baby is now on mother's milk, which we are giving through the tube.
Yes.
Today we are planning to remove the tube, and baby will be put on direct mother's milk.
Wow.
And then this baby will go home today.
Wow. So encouraging. Doctor, you always tell me good stories. At least to save life.
Yeah.
I'm happy about it and what you're doing here at KIMS. We can proceed, show me more cases.
Yeah.
I'll be fine and my people will learn more.
Yes.
Yes, doctor. Thank you.
So, Samuel, I would like to draw your attention to this baby. So, this baby was born to a mother who was struggling to push the baby during the time of delivery.
Yes.
So, what actually happens is that when the baby is in the mother's womb, baby doesn't breathe. So, as soon as the baby comes out, baby has to cry.
Yes.
Because crying is breathing.
Breathing, yeah.
If the baby doesn't breathe, then oxygen supply to the important organs of the body, which are heart, lung, liver, kidney, all will be limited, get cut. So for a duration, certain duration, around maybe a couple of minutes, 2, 3, 4 minutes, beyond which, if there is no oxygen supply happening, baby will die. So what actually happened to this baby was that baby was actually getting got stuck during the process of delivery, and then baby was removed with assistance with some machinery, but then baby didn't cry. So there was resuscitation process which was done, and then baby was shifted to us. Now we are doing, what we are doing is called as something called as cooling therapy. This is called cooling therapy. Cooling therapy. So cooling therapy is one of the advanced methods of treating such kinds of baby, wherein we decrease down body's temperature. This whole system is automatic system, wherein baby's body temperature is brought down to 33.5, 33.6.
Yeah, you can see the
this
temperatures are going down.
So what this thing does is, this preserves the brain. Preserves the brain. It is not just important to save baby's life. It is also important that baby has to survive and should be well with respect to brain.
Yes.
At 2 months, baby should be able to smile, take a smile at mother. 3 months, 4 months, neck holding. Baby should be able to sit at 6 months, stand at 9 months, walk at 12 months. All those things are called milestones. If baby achieves those milestones, baby will be fit to go to school at 6 years, 5 years, 6 years. So those things are dependent on factors that we do in the newborn period. So one of such neuroprotective factor is cooling therapy. This is one of the most advanced therapy that we are offering in this part of the world. And we have seen, with respect to our experience, we have been seeing that out of 62 babies whom we have treated in the recent past, almost 60 of them are doing perfectly fine. The remaining 2 have little speech delays. Even those things are also correctable. So cooling therapy is one which is what offered as a high-end care for babies, and this is not seen routinely in any part of the world.
Wow, this is very new to me, and I know most of the people don't know about this. And actually, doctor, you never disappoint. I know. We can proceed to another case. And I'm happy, at least now I know there is cooling. Wow. Thank you.
Hi Samuel, I have one more amazing story to let you know. So this is about this baby who at birth was having certain issues with regard to breathing. So when we evaluated, we got to know that this baby is suffering from a disease condition called as congenital diaphragmatic hernia.
Congenital
diaphragmatic hernia, which actually means that all the contents of the abdomen have been uh, pushed into the chest.
Yes.
So the diaphragm, there is a defect in the diaphragm, which is a separator between the abdomen and the chest. So this content of intestine, liver, spleen, that have a tendency to go into the chest.
Yes.
So with which, what is actually happening for a baby who is being developing in the mother's womb, the lungs as well as the heart, they get compressed because of this extra tissue.
Yes.
And then the lungs do not have good opportunity to grow. So which is how these babies suffer.
Yes.
Now for us it becomes very tricky to diagnose
Yes.
and then to treat these babies, because they are very tiny and they have to undergo surgical correction.
Yes.
Surgical correction is the only way to correct the defect.
Yes, true.
We cannot have a medical correction. Surgical correction is the only way to treat it.
Yes.
Parallelly, treating these babies for fear of infection and nutritional issues and other issues remains, it plays a very big role to play. Now, if I have to show you here,
Yes.
so we have so many equipments running here, and then we have this warmer above the baby,
Yes.
and then we have monitor, and then this is the ventilator.
Ventilator.
Yeah. So, like I was saying, ventilator is a machine which gives artificial breath to the baby.
Yes.
So the oxygen under pressure comes to the baby and it goes to the lungs through the artificial tube that we have placed here.
Yes.
And then baby has to have a little effort, but then predominant amount of breathing is done by this artificial machine.
Yes. Yes.
And then baby's temperature are automatically fixed by this artificially intelligent warmer, which maintains baby's temperature at 36.5.
Yes.
And the adequacy of the ventilator is told to us by this monitor. This monitor tells us this is doing its work well,
Yeah.
which is how we monitor this. And if when you see this long list of equipments here, all of these are helping the baby to survive. They have life-saving medications in them, which will help in pumping up the heart, which will help in making sure the baby's infection is under control. They'll all help in making sure that baby's pains are under control. They help in baby's healing.
Yes.
And then we also offer nutrition through these lines.
Yes.
So if you look at the baby, there is a tube which is in the chest, and then there are so many paraphernalia things happening around here. This baby has undergone surgery yesterday.
Yes.
And then the outcome of this baby depends on multi specialty doctors' involvement. It cannot happen by a single doctor. We need to have treatment being done by a neonatologist, a pediatric surgeon, infection disease specialist, cardiologist, cardiothoracic surgeon, and overall there might be requirement of pediatrician, lactation consultant.
Yes.
When multidisciplinary teams are involved, only then we can make sure that these babies tend to improve.
Yes.
If you look into the past history, 10 years back,
Yeah.
survival rate of congenital diaphragmatic hernia of this grade was 0. Now, with respect to our expertise, with respect to our technologies that we have at KIMS Cuddles,
Yes.
we've been able to make sure that the survival rate has jumped to 100%.
Wow,
So
that's
it is only
encouraging.
possible when we are doing things in terms of multidisciplinary care approach. So here I would like to introduce my friend, Dr. Avinash,
Wow.
who is a pediatric surgeon and a urologist who took care of this baby, did surgery for this baby.
Yes.
I call him not just surgeon, he's a magician. Magician. So he did the surgical correction.
Yeah.
And then now he has come for a follow-up to see this baby. I think he's also one of a very core important persons of the team to care of this baby.
Wow.
So I think remaining part of the baby's condition can well be explained by him.
Hi. Thank you, Dr. Babu, for your kind introduction. I am Dr. Avinash. I'm a pediatric surgeon. KIMS Cuddles, Secunderabad. We are a group of 2 surgeons, Dr. Yoga Nagendra and myself, Dr. Avinash. So, as Dr. Babu has told, this is a congenital diaphragmatic hernia. It is a rare condition, which is where what happens is, for any normal human being, there will be a barrier between the stomach and the chest.
Yes.
So
the diaphragm.
yes, that is called as the diaphragm. So what happens is there are a lot of defects in the diaphragm which they close when the child has to be almost born. It happens in the intrauterine period only.
Yes.
So failure of one of these defects to close causes this diaphragmatic hernia. What happens is all the intestines, the spleen and the solid organs, they come into the chest, and right from that day the lungs will not improve or they do not grow as required,
Yes.
causing there are a lot of medical condition called as pulmonary hypertension and hypoplasia.
Yes.
So that is a challenge which is taken care by the neonatologist, and our challenge is closing the defect.
Yes.
So once the baby was born, we got a X-ray done showing lot of intestines in the chest.
Yes.
So after 2 days of stabilization by the neonatologist, what we have done is we have surgically corrected the defect. So this is one peculiar case. Very few surgeons in the world do this operation. Especially, I'm telling you, it is not done by an open technique where we have opened the entire chest. This is done by a minimal invasive technique, that is only 3 holes which are a size of just 0.5 millimeters, 0.5 centimeters.
Repeat
Sorry.
again, they hear, doctor.
It is just 3 defects, that is 3 holes of 0.5 centimeters only. So the entire surgery, if you combine, it is just done within 1.5 centimeters of scars.
And how will you operate?
Yes, that is
How?
the we put 3 holes. In one hole we put the camera, and two other holes we have the instruments.
Yes.
So what we have done is, with one of the instruments we pushed everything in down into the abdomen, and we close the defect with suture. So we have sutured with the help of long instruments. So this is called as thoracoscopic repair. So
Do you have that machine here?
yes, we do have.
Can you take me
Yes.
to the machine? I see.
Yes, it is a laparoscopy machine where we use 5 ports, that is 0.5 centimeters ports, and a 5 camera.
Yes.
So we visualize everything what is going on in the chest. We push everything and close the defect with the. It is a highly skilled job.
Yes.
Only few surgeons in the world are doing this, and we are very proud that we have done this surgery with a thoracoscopic approach. So the normal conventional approach is open, where we open almost the entire chest and the abdomen and do
I
it.
can see no scar.
Yes, there are a lot of bandages, but once you remove the bandages and you see, you will definitely feel that the surgery has not been done. And the later part in their life, the baby also will not believe that the baby has undergone surgery. So
encouraging.
yes, and this is a lot less pain. So you have a big wound, big pain.
Yeah.
Small wounds, small pain.
The higher the wounds, the bigger the pain.
Bigger pain. So this is
smaller the wound, less
this
pain.
is the this surgery is not easily done, and we, as sir told, it requires a multidisciplinary approach. There's so much of work involved with the anesthetist, the neonatologist, and everyone.
Yes.
And we have done this surgery successfully in this baby.
Wow. Congrats, doctor.
Thank you.
You're doing a great job. You're
Thank you.
very you're inspiration to so many people who would wish and who
Yes.
think it is not possible.
Yes.
And I feel you should enlighten our people in Africa. They should
Definitely.
know these things. It is
Yes.
possible. Now, I have a question, doctor,
Yes.
before I go. How do these machines, they look like syringe. How do they operate this feeding machine to the kid, to baby?
See, what happens in the kids is every drug which has to go in very small quantities. So these machines are all highly calibrated machines. They
detect.
Yes, they have a
You
lot
don't
of
have
sensors.
to push.
Yes, they detect. They have sensors. They are calibrated very well.
Where are the sensors? I want to know that.
They are inside. Inside.
And now, where is that tube feeding?
Yes. See, they detect this syringe. Once you put the syringe, the sensors will detect the syringe. And based on the rate, the movement happens. And this movement is like you cannot see with your naked eye, which happens in a milli of seconds.
Wow.
So that is
Slowly,
delivering the
slowly.
drug.
Yeah.
Slowly. That is delivering the drug.
Very encouraging. This technology is good.
Yes.
Wow. Thank you so much for the
Thank you.
advice. I didn't know anything about this. But thank you, doctor. I knew once I'm with Dr. Babu, things are going to this man. Now he has introduced to a new friend and a surgeon, not just anybody. Yeah. Okay, by look, most of the people will overlook our doctor, because his body, they don't know what he carries in the brain.
Yeah.
Yes.
You can do such a very complex procedure, the surgery. The world. Wow, you are few in the world. Very encouraging.
I'm very proud to say that only few centers in the world are doing this. Very few. You can just
What
name
about in
or
the whole entire India?
yes, probably not more than 20-25 centers.
Wow, very encouraging. People should know.
Yes.
KIMS, you are doing a very good job. KIMS, the colors, special for children. Look at the place. Very encouraging. Thank you so much,
Thank you.
doctor. Yes.
Hi, Samuel.
Yes.
So this is again a very interesting and emotional story behind this baby.
Yes.
So this baby was born to a mother uh, before time of completion of pregnancy.
Yes.
This baby was born hardly at 6 months of age.
6 months.
Yeah. At birth, baby was very tiny, not even of size of my palm.
Yeah.
Baby was hardly weighing around 600 grams.
Yes.
And then everybody thought, including the doctor's team, thought that this is just an abortion and we cannot do anything about this baby.
Yes.
But then baby was showing some movements of the limbs and heart was beating here and there.
Yes.
We thought, why don't we give an effort to make sure this baby is well supported.
Yeah.
So we put this baby on ventilatory support under the warmer and we fed this baby through the umbilical cord. And then this baby, parents said, I mean, whatever we are doing efforts are actually futile efforts, because nobody believed that this baby will be actually able to survive.
Yeah.
Now it's been almost 2 months. This baby is fighting and fighting
2 months.
and has come out of the ventilator.
Now 1 more month to go.
1 more month to go, but then we are very confident that this baby from 600 grams has come to 1.5 kilos.
Wow.
And has been doing well, doesn't require oxygen support, doesn't require any injections, medications,
Breathing
by
on his own.
self, showing that yes, I am doing it,
Yeah.
I will do it.
Yes.
So this again,
He's
I
a
have to reiterate,
fighter.
yeah, this never give way.
Then
Yeah,
I
that
can
kind
see.
of attitude
Yeah.
has been motivating us to continue the support. I'm very sure with respect to the way with which baby has been showing the struggles and successfully being able to come out of those struggles
Yes.
has been, I mean, like giving us hope that in a couple of days this baby will also go home happy, fine, with good health.
Yes.
So now this, if I have to show you one photograph which I'll send you, a photograph shows baby's size is smaller than my palm.
Yeah.
But now, after 2 months, this baby has been
You
doing.
share the photo.
Yeah,
Yes.
has been doing magically fine.
Wow. This is encouraging. He's a fighter.
Yeah.
I can see the,
Yo, so
no ventilator.
No ventilator. So we deal with so many difficulties and problems in our life.
Yeah.
And then we feel that problem is biggest.
Yeah.
And when we see these tiny babies
You wonder.
facing such big problem and coming over it, we really wonder. And that thing motivates.
People should not give up.
Yes, we
People
should never give up.
continue to fight
Yeah.
to the end.
Yes.
Very encouraging. Thank you, doctor. Smiling. Oh, this is good. Thank you, doctor. Proceed to the other one. Doctor, what about this baby now?
Yeah. So these blue color fluorescent kind of lights that we are seeing here are called as phototherapy lights. Phototherapy lights.
Phototherapy lights.
Lights. Yeah. So they are basically LED lights. So if you have heard of a thing called as jaundice, newborn baby jaundice.
Yes.
Newborn baby jaundice. It's common thing wherein babies tend to have jaundice because their liver is still in the growing phase.
Okay.
So if at all a baby has jaundice and if it is beyond a dangerous limit, their brain might get damaged. So it is very important for us to make sure that jaundice is brought down.
Yeah.
So this is a phototherapy machine which gives specific 470 nanometers wavelength light.
Yeah.
So the beauty of this light is that it goes to the baby's skin, goes into the blood,
Yes.
converts that jaundice and throws this jaundice into the urine outside the body.
Ah.
And that is how we are able to treat this jaundice. So this baby is suffering from severe degree of jaundice.
Yes.
So which is how this thing was required to be offered. And now these babies are, we have been monitoring the jaundice levels through the blood, and it is consistently falling down, and then baby is doing good. So this phototherapy has been of great help because it doesn't cause any harm to the baby,
Yes.
doesn't prick, doesn't burn,
Yeah.
doesn't do anything.
Yes.
It only heals and cures with no side effects.
So it's like medicine.
Light medicine. Yeah,
It's a
it's a light
therapy
medicine.
itself.
Yes.
Wow, that is great. You know, most people don't know what is jaundice, what is caused by jaundice.
Yeah.
They don't know the liver is not fully developed,
Yes.
but at least now they know.
Yes.
I always tell them, you know more about children.
Yes.
Yeah, that's your specialty. Thank you so much,
Yes, ma'am.
doctor, and I appreciate. You are doing a great job.
Thank you so much.
The cadres, the doctors, the nurses, the paramedics here, they are doing a great, great, wonderful job.
Thank you. Thank
And
you
I
so much.
would wish to, even my people in Kenya, they should know that we should take life seriously, never give up.
Yes.
Like the boy
Yeah.
who has decided to fight for his life, now able to breathe by 8 months.
Yes.
Very encouraging. Thank you so much.
Thank you.
Thank you. Show us, show us. Oh, wow.
So this is called as spoon feeding.
Spoon feeding.
Yeah. So mother's milk is.
I've never seen it before.
Yeah. So mother's milk is brought and stored in the bottle, and then specialized nursing staffs.
Yes.
But then it's very difficult. We have to make sure that baby is actually feeding. Even a drop of milk, if it goes to the lungs,
Yeah.
baby has chance of dying. So it looks easy, but very difficult, skillful procedure, which nursing staff does here.
Wow.
And then we parallelly train mothers as well,
Yes.
because as they go home, they should be able to do the feeding with the spoon
Yes.
independently without a need of a doctor or a nurse.
Okay.
So this helps us to gain baby's weight
Yes.
and then achieve that age of maturity.
Yes.
Shall I say?
Yeah. Just introduce them.
Hi, this is my proud team. We are all team. We live like a family. These are all team of nursing staffs who take care of babies in the neonatal intensive care, and it is because of their daring efforts, day and night, the kind of monitoring that they do, kind of effort that they put, it is helping our babies to survive to a great extent. So it is the nurses who are the backbone of any neonatal intensive care unit, and doctors only do the decision making work, but nurses are the integral part of any neonatal intensive care unit. I'm very proud of my nurses. They always are on mode of being updated with the recent knowledge and updates. They improve their skills as per the need of the time, and then they make sure in absence of mothers, they act as mothers. So this fact of them makes our babies' outcomes in terms of health going great.
Wow, thank you, doctor. They look young. Why?
Yeah.
Why do you prefer working with young people, doctor?
So there are two aspects of this.
Yes.
So we want people who have the energy. The people should be full of energy. People should be interested, and then they continue to motivate. They have to be available whether it is in the day or in the night. And then if somebody who's dedicated to this, sky is the limit for growth in their career prospects. So these are all people who have been showing their interest in neonatology, which is why these people are looking young. Parallelly, I can say because they are with the babies, they will continue to be young. I have one nursing staff on my left hand side. Nobody can believe that she is 60 years.
60 years?
Yeah.
Wow, let's not talk. Wow. Okay, that's good. I want her to talk.
Yeah. She will.
Yeah. Yeah. Okay, no problem. Sister, just say something. Say something. Yeah, say something. Say something. Sister, I want you to introduce yourself to my people. Kindly. Just come close. Just come close. Talk to them.
ప్రాబ్లం నాకు ఇంగ్లీష్
Yeah.
ఉంది సార్
Just simple English.
మాట్లాడడానికి కొంచెం ప్రాబ్లం ఉంది సార్
Okay. Go ahead.
I am Aruna. My name is Aruna. Last 20 years in the KIMS hospital working in NICU, pediatric in neonatal intensive care unit. And baby take care and feeding counseling, feeding care. Next,
She's a great mother.
good.
Yeah.
I started, my daughters are good.
Wow. Thank you so much.
Cooperators are full.
Next. We go to next.
Next is
Sister here. Uh-huh.
Myself Subiksha. So I am going to be complete 3 months in NICU. So I am very proud to work here. So I like to take care of baby here. So finally I am very proud to work here in NICU.
Thank you so much. How old are you? Tell them.
So I am 21.
21. Wow. Congrats. Thank you so much. We proceed to the next. Can I have the mic?
Yes.
For this way.
Hello, my name is Namita. First, I want to say to Babu sir, thank you, because our whole nurses staff backbone of Dr. Babu sir only. So I'm very happy for. Firstly, though I don't have any experience neonatal, but here I'm stay and 8 months going to duty here, but like a teacher, like a all staff also cooperative. So thank you all.
Wow. Thank you so much. Next.
Hi, myself Krishnaveni. I'm a working nurse as a staff here. First of all, thank you, sir, for giving this chance to me. And as a working here, I'm so proud and I will tell happy. I'm happy to working here. Thank you, sir, for teaching us and guiding us. And we are so happy to take care of these babies and happy to say that baby is recovering.
Wow. Thank you. Next.
My name is Carol, and it's been 5 months I'm here. I remember the day I joined, Babu sir told NICU is a big this thing and there's lots to learn. But it is actually true. There's lots to learn. I came with zero experience, and today I am handling ventilator babies.
Wow.
So it's really great opportunity to learn staying in NICU. Thank you.
My name is Aditya and I came here for 2 months. So before also I have an experience from a neonatal intensive care unit also. So I'm proud to say like NICU is very good to learn more things. So I now also I am handling baby like like our home child.
Wow. Thank you. Next.
Hello, I'm Sriraj. Came only for 2 months. And this 2 months I joined here. And I'm proudly saying I'm the first boy in the NICU.
Wow. Thank you.
And thank you for Bowser too.
Bring the mic closer.
And thanks Bowser to bring me in here.
Wow. Let me ask you a question.
Yes.
You're a gentleman.
Yes.
How do you encourage young men in Kenya and Africa? How do you encourage them as a boy child?
Encourage. I encourage them to do handle the babies. Most of them to worry to handle the babies because they're scared of babies.
They're scared of babies.
Babies handle. I'm also first scared of babies to feed them.
Yes.
But now I am able to feed them with a spoon and OG. Well,
Oh, great. Thank you. Next.
Hi, my name is Aladdin. This is my first year in KIMS Hospital. So happy to work with the Cuddles team and KIMS Hospital.
Thank you. Next.
Hi, myself Alina. I have completed actually 6 months in KIMS Hospital, and this is my second month in KIMS Cuddles. Before I have worked in MIC2 neurology department. When I was transferred to here, it was very difficult for me to adjust to this. But when I see my seniors and my doctors taking care of the baby, how they are guiding us, I take my seniors and my doctors as my role models. Thank you, sir, and thank you, my seniors, for your guidance. Thank you.
Thank you, sister.
Thank you. My name Kavita. My 8 months completed here. Thank you, sir. Thank you for my Baba sir, Cuddles team. I take here all are good only. So all doctor cooperative, all baby also recovery and going fast. That one happy. Okay, thank you.
Thank you. Next.
Hi all, I'm working in NICU past 3 months. I'm proud to take care of these much babies at this age itself. Our doctors also pleasant. They teach us more by their grace. We learning everything day by day and upgrading our knowledge day by day. This is our greatest opportunity to learn everything at this age itself. Thank you.
Thank you.
I am Priya. Finished 3 months. More mistake is there. Yesterday also I got more mistake. Sir, training step by step trained, and after that again a mistake not there. Thank you, sir. Again that mistake not there, sir.
Welcome.
Myself, Angel Maria. I am just completed 3 months. I am very happy to be here to working.
Thank you.
Hi, myself Liba. After completing my internship, I joined here only. This is my first experience. I am thankful to Cuddles team and NICU. Thank you.
Thank you.
He's my team.
Tim, I would wish you to
Yeah.
say something.
So his doctor. As you all know, the care in NICU is not a single man's job. It requires a team work, a team effort. One of my strongest pillars is Dr. Satish, who's been working day in and day night, and he's been of great support in terms of decision making and in terms of taking care of the babies. So over to Dr. Satish.
Thank you, sir. Thank you for that introduction. Thank you so much. I'm happy to say that I'm working as a consultant neonatologist at KIMS Cuddles, Department of Neonatology, Secunderabad, India. So I've been working in this department since quite a long time, and I've been constantly working under Dr. Babu Garu, and he's helping me out in the way we are carrying out things here. And coming to the things, what we are doing actually here is we are following all the standard international norms, and we've been treating babies as per the international norms, and we have a pretty good outcome here. And one crystal clear example what I would like to mention is recently we've compared our statistics from the Indian statistics as well, where we have found that babies who are treated on INO, we have got 100% outcome of INO support babies, and we are also treating all the neonatal babies with the state-of-art equipment here. So the equipment what we are using here is even in the US, UK, the richest countries, they don't have such kind of an equipment. We have the India's first state-of-art cooling equipment here. So we have got a very good outcome out of that, and no baby actually had any other worsen outcome through that equipment and all. So on the whole, what I would like to say is we are happy serving the babies under the leadership of Dr. Babu sir, and we would like to take this pretty forward, and thank you so much for that.
Thank you, doctor. We appreciate your efforts to take care of our babies.
Sure.
Thank you so much. Have a good time.
Thank you.
Thank you.